Welcome. In this video guide, brought to you by the Department of Healthcare Services, we will walk you through the new Behavioral Health Services Act Integrated Plan Budget Workbook, tab by tab, so you can submit an accurate and policy-compliant budget for your integrated plans. Through this guide, we will go through the following goals: understanding the why behind each tab, see examples of real data entry in action, and learn how the validation flags function. There is also an instruction manual available for the Integrated Plan Budget Sheet as well. Visit the DHCS website for more resources and information. As we go through each of the sheets within this workbook, please note there are also instructions and notes listed at the top of each sheet for reference. There are 10 sheets in total. For some of them, there will be citations at the bottom of the sheet for reference as well. The first sheet of the workbook is reporting on the Behavioral Health Continuum of Care, abbreviated as COC, expenditures. This opening sheet captures a county's full programmatic spending plan across the behavioral health continuum. By reporting all funding sources, such as BHSA, federal, state, and local funding, the sheet provides a single look at how counties are balancing investments between mental health and substance use disorder services, and an even closer look at things like crisis alternatives and population-level prevention. Please note, counties must report projected expenditures for all potential behavioral health funding source categories, including those not limited to BHSA, across the 3 fiscal years. These service categories, whether related to substance use disorder, mental health, or housing, should include programs that are provided in the county either directly by the county behavioral health department or through a county contracted provider. As mentioned earlier, the top of the sheet includes brief instructions on how to complete the sheet. As a reminder, please also see the Department of Healthcare Services Integrated Plan Budget Sheet Manual Guide for additional guidance as well. Table 1 will report on the Behavioral Health COC projected expenditures. For each services category, such as substance use disorder services, mental health services, and housing services, please tick the checkbox for the services that are provided in your county. For each service type row line, the total projected expenditures for clients will also be reported by each year for the 3 fiscal years covered within the plan. These last columns will also require the reporting of projected individuals to be served within each service type. These numbers may be duplicated. And at the bottom of the table, all totals will be auto-populated. Please note that all gray cells are auto-populated. The second sheet of the workbook is reporting on other county expenditures. This tab isolates activities outside the direct service or care continuum, taking a closer look at things like capital projects, workforce development, and data information technology infrastructure, and other behavioral health transformation initiatives. Segregating these costs helps track how much of an allocation supports frontline care versus system capacity building. For this sheet, we will simply enter annual dollar totals for each of these categories for each of the 3 years within the integrated plan. The last row on this sheet will again auto-populate the total projected expenditures. The third sheet, titled Total County Behavioral Health Expenditures, is now reporting on the projected annual expenditures by county behavioral health funding sources. This sheet flips the lens from programs and service types to funding sources. It asks that we list every revenue stream, things like BHSA funding, 1991 and 2011 realignment, the state general fund, federal block grants, and federal financial participation, etc. The first column breaks out all of the main funding sources, followed by other potential sources that counties may utilize. Consistent with the previous sheet, reportings must be made for each of the 3 years within the integrated plan. The bottom row here, titled Total Projected Expenditures, will auto-populate the totals from above. The following row, titled Total Projected Unspent BHSA Funds, will require a manual entry reporting the anticipated amount of unspent BHSA funds from prior years. The bottom two rows include validator checks to ensure that aggregate revenue is equal to the total projected total spend reported on the previous two sheets. You may use this to assess any gap or discrepancies. You will be able to see whether or not the total projected expenditures are within the calculations of total revenue spending and unspent funds. And if it is not, you can reassess the entries. Let's take a look. For simplicity of this example, we will use a few entries and simple numbers for reference. In this example, let's say that we are reporting a total of $300,000 in projected expenditures on the first sheet for the behavioral health COC expenditures. This will be $50,000 per year for all 3 years for both projected expenditures on adults and older adults and projected expenditures on children and youth. Let's also say that we will also be reporting $50,000 of projected expenditures per year for all 3 years on capital infrastructures on the second sheet. The total will auto-populate at the bottom of our current sheet. Our total expenditures totaled $150,000 for each year. Say that our total revenue amounted to $200,000 each year. This would mean we should be reporting an amount of $50,000 of unspent funds each year. With the calculations here, we can now cross-reference the amount of revenue and unspent funds that we are reporting from our funding streams and see if it aligns with our projected expenditures. We can validate and see that our total reported revenue, unspent funds, and projected expenditures should align in calculations. This next sheet, titled BHSA Transfers, captures every reallocation that counties plan to make across the 3 components: housing intervention, full-service partnership, and behavioral health services and support over the 3-year budget window. Please note, there are a few major statutory requirements that will be considered in the transfers sheet. 1. Per the BHSA County Policy Manual, starting with fiscal year 2026 to 2027, all counties can request changes to the funding allocation percentages. Counties may request to transfer funds between the 3 BHSA components. However, there are 2 important limits to keep in mind. First, no more than 7% of the county's total annual BHSA funding can be transferred out of any single component. Second, across all components, the total amount transferred in a single fiscal year cannot exceed 14% of the county's total annual BHSA allocation. 2. Per Welfare and Institutions Code Section 5892, a county's prudent reserve must not exceed 20% of average of the total funds distributed to the county Behavioral Health Services Fund over the past 5 years. For counties with a population of less than 200,000, the cap is at 25%. 3. Counties may redirect unspent MHSA funds after July 1, 2026 to BHSA components. This sheet has a few areas to be discussed, so let's take a closer look by sections. Welcome to Table 4, BHSA Transfers. This first part of the table is the summary section, which is read-only and auto-populated by entries made in the later sections of this sheet. Notice that there are reporting rows for each of the 3 fiscal years of the integrated plan, titled Year 1, Year 2, and Year 3. For each year, the reported adjusted total allocation percentages, including exemptions and transfers, will populate here, and the projected component allocation, based on adjusted allocation percentages, will populate in the row beneath. Being out of compliance of any of the policy guidance mentioned earlier will result in a validation error, and the data entry will prompt a pop-up message box notifying you that there is an error in your entry. We will take a look at this in a moment. Let's move on to the next section, the BHSF Housing Intervention Component Exemption section. This section allows counties to report and track any intra-component transfers, whether you're shifting funding out of housing interventions or into FSP or BHSS, etc. As a reminder, counties must request and receive approval from DHCS for a housing exemption. If a housing exemption has been granted, a county may be permitted to make transfers in this section. The required base percentage is auto-populated here. Counties will have to report the allocated housing intervention funds to the right. Then, for any transfers, counties will then enter the percent being transferred out and any percentage of funds being transferred in. To the right of each of these cells will auto-calculate the percentage amount in dollars from the allocated base funding. The bottom row will then automatically calculate the new housing interventions base percentage based on any transfers being taken away or added in. Please note, all values will be entered as positives for both amounts transferring out and amounts transferring in. The workbook has validated amounts transferred out as negative values in the internal formulas. Let's take a look at how the validation checks will work. Again, for simplicity of this example, we will use a few entries and go over simple numbers for reference. Let's do some sample entries into the section titled Funding Transfer Request Allocations. Remember, statutory guidance states that transfers cannot exceed 7% of total county BHSA funds from any one component per year, and the total amount transferred in a fiscal year cannot exceed 14% of total county BHSA funds. So for year 1, if we were to transfer 4% out of housing intervention and 3% out of BHSS, this would total 7% of funds being transferred out for the whole year, with those 7% of funds being transferred to the FSP component. The new base percentage after the funding transfer request will be auto-populated with the new amounts. The total of those adjusted percentages should still total 100%. This is an ideal scenario. Let's now look at an example that will prompt a validation error. Now say for year 1, we are trying to transfer out 7% from housing intervention and 8% from BHSS. This will prompt this error message reading, "Error, this entry is not valid. Please input a different value." This is because our total percentage of funds being transferred out will exceed the authorized 14% total amount of transferred funds in a given year. The same error message will also prompt should we enter more than 7% of funds transferred out of any single one component, as this is also disallowed. Let's take a look. See, the same message will prompt. These validations will also occur for the percentage of funds transferred in the row beneath as well. So please remember the statutory guidelines and be sure to adjust your data entries accordingly should you see any of the validation messages pop up. The final sections of this sheet are titled MHSA Transfers to BHSA and Excess Prudent Reserve to BHSA Components. The first part is where counties will report any unspent MHSA funds as of June 30th, 2026, and how those funds will be reallocated into the new BHSA components beginning fiscal year 2026-2027. The last section is for counties to reallocate any local prudent reserve dollars that exceed the statutory maximum of the new BHSA requirements. Any prudent reserve dollars exceeding the new statutory prudent reserve maximums as stated in Welfare and Institutions Code Section 5892 must be reallocated to the BHSA components. This ends the first half of the Integrated Plan Budget Sheet video guide. Please see the second half of the video guide for guidance on how to report on the remaining sheets of the Integrated Plan Budget.